Tony, it's great to be with you today. Very excited to learn a little bit more about your company, your solution, and the work that you do. Let's start with some introductions. Tell us a little bit about your role, and about the company as well.
Sure, sure. So my name is Dr. Tony Kimani, and my background is in internal medicine and the subspecialties. So I've trained in pulmonary diseases, in critical care medicine, and in sleep. And so my current practice is in a teaching hospital part-time, but my main focus is really at the intersection of business, medicine, and technology. I'm very, very interested in bringing new solutions that are physician generated
Mm,
to the whole area of ER and urgent care. So that's why I founded PreMedicus. It was a spinoff from my days at Georgia Tech in the business school, and I've been working on basically, creating a solution that optimizes and humanizes
hmm,
emergency care.
okay. Well, I'm excited to get into that, but let's start with I know you're bringing a physician's perspective to this, but what are the key problems you were looking to solve, and why are they important to both the clinician and the health system?
Okay, that's a really good question. So really, when patients are acutely ill, matching the patient to the right care at the
Mm,
right time and in the right setting is critical. Right care is important because patients are very anxious when they're acutely ill.
that's
You
right.
want an answer to that question, what's wrong with me right now? There's
Right.
so many implications to that. The second thing is the right time. You want to be able to identify high-risk patients faster so that they get evaluated
Mm,
earlier and have less morbidity, less complications. Then lastly, it's the right setting. So when you direct patients to the right level of care, then you do two things. Number one, you spare them unnecessary costs of an ER visit, because a lot of insurance plans now make you pay a
mhm.
lot for it. And
Yes.
then secondly, you start dealing with the ER congestion problems where, people are coming in who don't need to be
Yes.
there, taking time and resources away from the people who really do. So the first problem we're solving is kind of matching the acutely ill person to the right care at the right time in the right setting.
Okay.
And then the second is related to that. We're improving the quality of the in-person ER visit, and not
Okay.
just for patients, but for everybody, for providers and for staff. And
Okay.
that's important because it's very important to humanize the patient journey. I mean,
Mm,
the ER scenario is something that most people would avoid at any cost.
yeah.
It's really
Yeah.
not
Yeah.
a very pleasant experience. And it's a stressful situation for the staff and for the providers who work there.
Right.
It's also an area of high focus for diagnostic error.
Mm,
And so trying to make that an environment that's safe for the patient, as well as a good work environment for the staff, is an important thing that we have on our agenda.
that's very helpful. So the matching right care, right setting, right time, and
Correct.
make it a safe and efficient process when you're in the ER for both the patients and the care team. So how does PreMedicus solve some of these problems?
All right. So we can't do it all in one way, but
Yes.
we actually
Okay.
have two mobile app solutions. Okay.
Two mobile
So,
applications.
right.
Okay.
So for the right care, right time, right settings, there's a mobile app called PreMedicus ER. Okay.
Okay.
And so this is a patient-facing decision support technology.
Okay.
And it
Okay.
falls into that new category that AVIA has created. There hasn't been much in that space, but
Mhm.
what PreMedicus ER does is when a user, a sick patient, spends 5 or 10 minutes inputting their demographics, their medical history, and answering some questions about their symptoms, that information is processed by our proprietary clinical algorithms and then gives them two things: a preliminary diagnosis and a triage decision. And both those things, yeah.
Okay.
So
Yeah.
number one, answering that question, tell me what's wrong. You have a preliminary diagnosis based on the information that you've given, and it's actually hyper personalized to you.
Hmm.
In other words, because you've given us your medical history, the medications that you're taking, your family history, then it's not going to be a Dr. Google response. It's going to be really tailor marked to you in terms of what could possibly be wrong.
Do you
That's the
need
first thing.
the person's clinical record to be part of that, or is it just what you enter?
Yeah, so we've made it very easy for patients to click check boxes for the things that affect them.
Okay.
In the future, we'll be able to import their medical history. Right now, it's kind of difficult because it's
Right.
everywhere. Yeah. But
Yeah.
I think when that gets democratized, I think
That's
we'll be able to pull that in and help them with that piece. But it doesn't take very long.
Okay, so that's the patient-facing mobile app that does a little bit of triage. I have to ask this, for a high acuity situation, how many people can really have the wherewithal in that moment to use a mobile app? Because I've seen triage solutions for low acuity solutions,
Right.
but in a high acuity, is there a range of things? I mean, of course, when if you have a severe injury or something, you're not going to be opening up a mobile app.
Yeah.
What is the range of situations when this is actually useful?
Well, that point is well taken. But I think when people really feel that they're in dire straits, they know to call 911. So that's not the patient who's
So
going
if
to
you're
be reaching
eliminating
for
that,
yeah.
yeah.
So the patients that are that we're concerned about are those patients who feel sick, not quite so bad that they know they have to go to the ER, call
But they
911.
don't know
They're
where to
toying
go.
with the idea. They're
Mhm.
toying with the idea. They're not quite sure if this chest pain is just heartburn or if it's
That's
a
right.
heart attack.
Right.
Okay.
Yeah.
So you haven't passed out, yeah, nothing else has happened, but you're just in that area where you're concerned. And I think that's where the majority of the people are. It's a small number of people who really are having acute stroke symptoms or who are bleeding or broken a leg. I mean, all those are very obvious reasons to go to the ER.
Got it. Got it. And I mean, I think I can personally relate to that. I'm sure a lot of people do. It's like, is this an ER worthy situation? Because
Absolutely.
there's also risk, right? Like I'm like, because I had a friend I had taken to an ER once and she thought it was an emergency, but then you go there and they triage you and then you're waiting there 6 hours. So is it even worth that experience? So
Exactly.
it is for all those situations that it's not 911, but it's not just the sniffles either. It's in between.
Right. The in between. Yeah.
Okay.
And what if you're out of town? Okay. And you don't know where to go. So,
Right.
we GPS people to the right setting.
Okay.
So we'll send you to the right places. And then we'll also give you some, credible education so that when you're sitting in the emergency room, you have something to read about your symptoms and have good questions to ask the physician who sees you. You see, so that makes that interchange that you have with the care provider much more meaningful.
That's right. Okay. So that was one part of the solution. You said there was
Correct. All right. So the second solution has to do with improving the in-person ER care. And so, we really went after a comprehensive solution because piecemeal solutions don't really work. If you have to gather 4 or 5 different resources, especially software that doesn't play well together, it doesn't make sense. So basically what we're doing is doing several things. We're doing some of the administrative tasks that take time and take time away from care providers. So things like patient registration and insurance verifications. We do that, we automate that. We also automate some of the coding and billing things. So those are the administrative tasks. We try and take those off the table. An important thing that we do differently is that we collect the patient history firsthand. So when you go to the ER, typically what happens is someone interviews you and enters that information. And I can promise you that you're not the only patient on their mind. They've seen 2 or 3 other people, okay? And when they're writing it down, it's easy to mix up your story with somebody else's that kind of had similar issues. With that can have bad consequences, but it's busy. Nobody sees one patient, finishes with them, and goes on to the next. They got 2 or 3 people's stories kind of circulating in their brain. Okay, and that's just the reality of it. So, if the patient can speak in their own voice, using voice recognition and answering questions that are pertinent to them, then that does 2 things. Number one, it gives them a seat at the table. The story is being told, the way the story happened, they have confidence in that, and that gives time to the physician to kind of read those responses beforehand and then come in and ask clarifying questions. And so now that becomes, I think, a much more meaningful document because the history really drives diagnosis much more than the physical exam and other testing. But that's where, unfortunately, not enough time is spent in the heat of the emergency department encounter.
That's right. That's right. And so one of the questions you usually like to ask is, how is it different from other solutions? Are there other solutions that do pieces of these or that are similar? How would you say yours is different? If a health system is looking to buy or contract with PreMedicus, what would you want them to know?
Okay, so again, we're in that patient-facing decision support piece, and we're trying to do it comprehensively. So I think a comprehensive solution is very important. There are revenue cycle solutions that will help you with your billing and all of that, and we're not trying to step on those toes. But what we're trying to do is to keep you on one platform that solves your problems and increases efficiency. Okay? So that way, the patient is charting asynchronously. The physician is charting asynchronously. The staff are putting in their information, and the software pulls it all into one document and makes it very easy for the patient to see what's going on in their own encounter, even as labs come in, and for the physician to be able to see what the patient has done. So that comprehensive nature is very, very important for this. The other thing is being patient-centric. We were really trying to keep the patient at the focus, at the center of everyone's attention. And this has actually impacted how we designed the software, how we tested it, the usability, the features that we included. It's very, very important. And being a provider myself, there's compassion for providers because we know about the cognitive burden there is for data entry and doing things that just really have just been forced upon you and don't really add value to what you're doing. And then lastly, we're committed to clinical excellence. So we want to test these objectively, scientifically, and prove that we are improving the ER environment, that patient engagement is measurably better. So those are the ways that I think we distinguish ourselves from, other people who are somewhat in that space.
Yeah. And a question I have to ask, because every health system we work with, when they're contemplating a solution like this, they always say, how does this actually integrate into the existing clinical workflows and integrate with the EHR? Can you tell us how that happens with the voice charting and all of that?
Yeah, so we've been very mindful to integrate the software with how care actually happens. So, really the first stop typically is the triage nurse. And this triage nurse takes your vitals, talks to you, and then kind of parks you in the right spot, hopefully, for you to be seen in due course. And so we start with the triage nurse. I've spent 30 years taking care of patients and seeing patients in the ER. So I think we've done a good job with that flow. The second part of it has to do with interoperability.
A question. So the triage nurse has the PreMedicus solution that she or he is interacting with. Is that within their EHR workflow? Is it separate? What does that
right. So this would be integrated into the EHR workflow, correct? Okay. And so, depending on which one, the APIs are designed to kind of handshake very well.
Got it.
So that they're kind of all working in one place.
Yes. Okay.
Yes. And
you
then
were saying something else about the APIs, I think. Yeah.
Oh yeah, so the API shake hands well, and all this information is happening in the cloud. So we have an Amazon Web Services HIPAA compliant server that is running these interactions in the cloud, so that the cybersecurity and the privacy concerns are all really addressed from the end user to the cloud.
Yeah, and then of course I have to ask the question, because any health system to take on any new technology project or to do anything more will always ask the question of ROI and metrics and KPI to make sure that the effort that's required to create any sort of change for anybody, particularly the clinical staff, there is a clear ROI that is worth all that change. So tell us how you think about that. What results are you already seeing?
Okay, so really, we're looking forward to piloting actually with a forward-leaning health system, that sees a fair amount of dysfunction in the ER environment, knows that there are opportunities for improvement, and wanted to try a solution, pilot a solution with measurable outcomes. And so that's really what we're on the AVIA platform for.
Excellent. So you are, for those who are listening, you're looking for one of those pilot sites. So anybody who has issues with ER boarding, all of that, they should be thinking about PreMedicus as a potential solution there.
Correct.
Fantastic, fantastic. As we close our time together, anything else that you'd like to share about your work or your solution or anything else?
Yeah, just a word about the whole patient-facing decision support category. It's really a very dynamic and fluid area. This space is seeing a lot of activity from generative AI,
Yes.
trying to be used for acute care clinical diagnosis, for triage, as a co-pilot to reduce medical errors, and it's with mixed results. So we're really forerunners in this area in terms of working with AI. Our current solution does not have AI, but we're being very thoughtful and careful about how we incorporate AI so that it actually augments the expert system we've built rather than add a layer of confusion and potentially worse outcomes.
Yeah, yeah, that makes a lot of sense. I think we'll see a lot of evolution in this space in the
Absolutely.
coming years, and it'll be
Absolutely.
see how both patients, care teams, and ultimately society we accept, the risk associated with it, and will the reward outweigh any of the risks?
Absolutely.
Yeah, but thank you for your time. It sounds like some really exciting work ahead, and a really interesting solution to problems that you have faced yourself and you see yourself in your work. So thank you for sharing some of that with us. For those of you who want to learn more about PreMedicus on the AVIA Marketplace platform, you'll be able to find more information and even ways to contact the team. But Tony, thanks again for your time.
Thank you so much.
Appreciate it.
You too. Bye-bye.